So I've had the pleasure of knowing Samba since we actually did our IBLM accreditation together in 2022. I also had the pleasure of meeting her when she came to Cape Town a few weeks ago. And all I can say is she genuinely is one of those people who embody everything lifestyle medicine stands for. She graduated medical school in Romania, and speaks better Romanian than me, despite my mother being Romanian. And then she went on to work in Botswana, in Francis town, where she currently is a general practitioner and director of the Sarah Holistic Care. She has multiple accreditations, including her certification in lifestyle medicine, health behavioral change, a certification in mindfulness-based interventions, and trauma-sensitive mindfulness. She works as a diabetes prevention program certificate and coach, as well as a wellness coach. On top of all of that, she is actually the founder of the British Society of Lifestyle Medicine.
Sorry, Botswana.
Botswana Society of Lifestyle Medicine. Thank you, Dave. I don't know where I got that from. And is a member of the Botswana Addiction Professionals, International Society of Substance Use Professionals, and the International Addiction Coalition. So she is definitely someone we can learn so much from. And the reason we're so excited for today is helping people change is really hard. Helping people cope with addiction is extremely tough. And I think, there's so much research now being into that. We're seeing people being addicted to everything and anything, right? Some are more harmful than others, but ultimately they all end up being addictions, even exercise. So, Samba, we are very, very excited to have you with us today. And I think I say on behalf of everyone, you've always given so much to us. So this is just another gift. And with that, I will be sharing the presentation and you'll just tell me when you need me to change slides.
Thank you so much for that warm welcome. Yeah, good to see some old friends, some new ones. Good to see you all. And thank you so much for having me today. It's a thrill to be here. And thank you for your patience with the technology that decided to play up at the last minute. Okay, so we'll start with our first slide, which will be a little practice to get us grounded in the moment.
How do I get anything yet?
Thanks. Okay. So
hello.
This is a 1 minute breathing space, which I find very useful.
So just give me 1 second. Just give me 1 second to format this.
No problem.
It's not format. Just give me 1 second.
Okay, no problem.
Samba, can you hear me?
Yeah, I can hear you. Yes, iPhone. Yeah.
I'm Jacinta.
Oh, hi, Jacinta. Yeah.
I don't seem to be able to get anything. I'm only seeing my own face.
Oh, okay. Okay. Yeah, but yeah, we can only see iPhone. Yeah, but I can hear you. Thank you. All right. Thanks for being here. That's my friend.
Yeah, but I won't be able to see your slides. I wanted to see what you're doing.
Can other people see your? I'm screen sharing. Can everyone else see the screen?
I can only see iPhone. I think you may not have your video activated, maybe, because I'm only seeing iPhone there. Maybe
wait,
activate.
Can everyone else besides Jacinta see the screen?
Yes.
I can see the screen. Thanks, Akira.
Okay.
I can see the screen.
Okay, then I think, Jacinta, the problem might be your settings on Zoom. Try and just go to your settings for what you're seeing in terms of camera, and try and change the settings on your own. There's like a picture with like a little block and a big block. Just try clicking on those and it should change it. Okay. All right. If there are any problems, please let us know. Otherwise, the floor is yours.
Thank you. Thank you so much. And yeah, help me to bring myself back to the present moment, because after all the preparation at the last minute, things just seem to go. So I really need this 1 minute breathing space. And I'd like to invite you to also take this moment to get centered. So just finding a comfortable position where you are, whether you are seated, lying down, whatever is a comfortable position for you this moment. And just bringing attention that is wide and open to just all that is landing for you at this moment. Just scanning and thinking, what's happening in your body? What sensations are you experiencing? What thoughts may be going through your mind? What emotions may be coming up? Just scanning without judgment, but with this wide lens. And should the mind wander, as it will, just gently note where the mind has gone and bring it back to scanning, to being in this moment. And now, with your next in-breath, just narrow that focus and just watch that breath, observe the breath. Just focus on the breath as it enters the body, perhaps hits the back of the mouth, gets into the lung with an in-breath, and you breathe it out as an out-breath. Breathing out, again widen the lens. Again, focus on the whole body, breathing here, from head to toe, grounded in this moment. And perhaps bringing aware of what sounds there may be in the room. And just gently come back into the room, into the meeting. Thank you for your practice with me. And we can now go on to the opening slide. So next slide, please. Thank you, Akira. So the presentation is going to be on mindfulness-based went too fast. Okay, so the outline of the presentation will be a brief overview of mental health and unhealthy behaviors, why they are important today, and a reminder of what lifestyle medicine is all about, what is mindfulness, a bit of a background, and then give some examples of mindfulness-based programs and mindfulness-based interventions, and then talk about digital health and digital therapeutics and the neuroscience of habit formation, which is why we're here today, and focus on tools that work. I will be sharing on tools that I have found useful in my practice, that I have found useful in my personal life, as well as I've been able to share with the people that I serve. So a bit of a disclaimer here in that what I'm going to share today will be apps and tools that were developed by Dr. Judd Blair, whom I work with in share care as a behavior change facilitator. So yeah, that's my disclaimer, but those are the ones that I'm familiar with, that I thought it would be useful to explain. And the last point will be about the importance of putting on our own oxygen mask and PPE. Okay. Yeah, thanks. This is your next slide now. Okay, so overview of prevalence of mental health issues and unhealthy behaviors. So according to the WHO, globally, mental health disorders account for 1 in 6 years lived with disability. A lot. So people with severe mental health conditions die 10 or 20 years earlier than the general population. And having a mental health condition increases the risk of suicide and experiencing human rights violations. The common ones that we will be looking at, that these apps would be addressing, are like anxiety, depression, overeating, tobacco use, alcohol use, and drugs other than alcohol. And it is important addressing these issues through innovative interventions, because right now we have challenges in the availability of time and trained personnel to effectively offer service to people who are living with these conditions. And while medications do work, and we're so grateful for the antidepressants and all those other wonderful medications that are there, it is known that there are challenges. For instance, the number needed to treat for SSRIs is 5.15. So I would have to treat at least 5 people before I could expect that one person will respond reasonably. I think we've had the experience where people need to try different medications before they can find an antidepressant or whatever that really works for them, that really helps them. And of course, there are always the undesirable side effects of the medications, especially in this age when we're living with people being on medications for multiple different conditions. And then the other point too is that the rising excess weight epidemic and the consequent challenges of type 2 diabetes and hypertension is not just a simple calorie in, calorie out. People may know about what to eat, how or whatever, about the calorie, whatever, but human behavior is complex. So how do we help people form better relationships to their eating behaviors as well as other lifestyle behaviors? And we have the double burden of infectious diseases and non-communicable diseases. All right, so lifestyle, what is lifestyle medicine? This is just a reminder in case there are people in the room today who are not familiar with what lifestyle medicine is, that it is a medical specialty, uses therapeutic lifestyle interventions as a primary modality to treat chronic conditions, including but not limited to cardiovascular disease, type 2 diabetes, and obesity. Trained lifestyle medicine certified clinicians such as us are trained to apply evidence-based whole person prescriptive lifestyle change to treat, and when used intensively, often revert such conditions. Applying the 6 pillars of lifestyle medicine, a whole food, plant predominant eating pattern, physical activity, restorative sleep, stress management, avoidance of risky substance use, and positive social connections also provide effective prevention for these conditions. And those are the 6 pillars there on the right side. Next slide, please. So what is mindfulness? So there are various definitions, but basically it is paying attention on purpose to what you're thinking and feeling. And it creates awareness of the space between a stimulus and a response, so that one is not reacting, but one is actually finding a skillful way to respond to whatever it is that is arising. And it's about being fully present in the moment. And it's experiencing a situation in its entirety without trying to get, do, or be somewhere else. And it's also being aware of your surroundings and withholding judgment or interpretation, just having an attitude of gentle curiosity and noticing. Having said all this, I know there may be many questions as to what do we mean by acceptance, etc. And it needs to be emphasized that it's not about just accepting that everything is okay. The withholding judgment is saying, this is what's happening now. This is what has arrived here now in this moment. How do I work with this? So it's acknowledging. It's not just saying that anything goes and everything is all right and we agree with everything. I think that's an important thing to point out. Next slide, please. Okay, so some background. John Kabat-Zinn is thought to have with bringing mindfulness into mainstream medicine, into secular medicine. But when he developed the mindfulness-based stress reduction, which was meant for people with chronic pain and stress in the 1970s. And he defines it as awareness that arises with paying attention on purpose in the present moment, non-judgmentally, and then in the service of self-understanding and wisdom. So it's all about an inner awakening. We're all capable of mindfulness. It's just about learning how to tap into our innate capacity to be mindful. And I like to point out that there are no mindfulness teachers as such, but there are facilitators that help us to understand how we can tap into each of our own inner resources to be mindful, to be present, to be aware in the moment. If I can just make a point here that we tend most of the time to live life in what is called autopilot. So we're doing things, we're going about, but we may not be really present here and now. And part of the mindfulness training is learning to bring ourselves back to the present moment, to be here now in this moment. And some of the 9 attitudes that facilitate this kind of behavior is having a beginner's mind, so being curious and open, just like a child, non-judging, so just acknowledging, noting this is what is happening without necessarily having to have a strong reaction of I like this, I don't like this, or it's bad, whatever. Acceptance, so like acknowledging, letting go, trusting in the process, having patience with ourselves and with the process, non-striving. So when we do these practices, we do these practices for the sake of the practices. We don't do the practices with the aim of getting somewhere. We'll talk more about that. That's how it works. Because when we start striving, if I'm going to do a practice because I want something to go away, I want a feeling to change, it really may not work. But if I can just breathe in for the sake of breathing in, then I find that actually I'm grounded and my anxiety has gone away. Having an attitude of gratitude and generosity. Thank you, Sophie. Next slide, please. Okay, so now I'll talk a bit about mindfulness-based programs, also known as MBPs or mindfulness-based interventions, MBIs, about the same. And this is part of the training that I did at with the Institute for Mindfulness South Africa at Stellenbosch University. It was in mindfulness-based programs. And this is a bit of a complex definition, but I thought it might be helpful to better explain what they are. So they're informed by theories and practices that draw from a confluence of contemplative traditions. And these are contemplative traditions that are not just necessarily from the East, but all cultures have a certain amount of contemplative traditions in them. And it also draw from the science and the major discipline of medicine, psychology, and which is ever evolving, as we know, and education. And they're underpinned by a model of human experience, which addresses the causes of human distress and the pathways of relieving it. Develop a new relationship with experience, which is characterized by present moment focus, decentering, and an approach orientation. It catalyzes the development of qualities such as joy, compassion, wisdom, equanimity, and greater attentional, emotional, and behavior self-regulation, and engage participants in a sustained intensive program in mindfulness meditation practice, in experiential inquiry-based learning experience, and exercises to develop understanding. So I'll explain a little bit here in that when people take part in these mindfulness, in the formal mindfulness-based programs and interventions, as I said, they are just being led, facilitated by the so-called leaders. There are no teachers. We believe that each person is their own unique teacher. Each person has their own innate inner wisdom. So the role of the facilitator is just to help guide, to say, okay, try doing this and see what you notice, what's going on in your body, etc., so that we develop this inner awareness of our own potential and our own capacity to be able to be mindful and to be present, to be in this moment, to be with life as it's unfolding. So we all have this capacity in us, and these mindfulness-based interventions are just there to help water and nurture and bring out this capacity in each of us. And there are some more structured ones according to the different conditions that people may be struggling with. So that the mindfulness-based stress reduction, which I said was originally for stress and chronic pain. There's the mindfulness-based cognitive therapy, which was developed especially for people with depression because they tend to have relapses. So to help them to better stop getting into relapses with depression. And then there's the mindfulness-based relapse prevention, which has been developed especially for people with addictions to substances. There's also the mindful-based self-compassion. And yeah, so there can be many of them, but they are characterized by formal and informal practices. So the formal practices would have you maybe sitting and formally meditating, different kind of meditations, 10, 20, 30 minutes at a time, a day, etc. And then there'll also be informal practices that invite us to be mindful as we're driving to work. So being aware of where we are, what we're sensing, what we're feeling as we're driving to work, or as we're washing dishes, being aware of the soap, the water, etc. As when we're having a shower, for instance. So having a shower and not a committee meeting in the office, it's actually having a shower. So all these practices, as we practice them, help us to be grounded and to be present in the moment. And the mindfulness-based interventions, they will be over 6 to 8 week sessions, and they're about 60 to 90 minutes each that these people go through. And there's a link there where you can learn more about what actually constitutes mindfulness-based programs. Next slide, please. So I picked here 2 examples. This one is mindfulness-based cognitive therapy. And what is it? We may have heard of cognitive therapy from our lifestyle medicine training. And this is a combination of cognitive behavioral therapy with the mindfulness meditation practices. And they include the principles of non-judgment, patience, open-minded, trust, non-striving, acceptance, and letting go. And it incorporates these principles into cognitive behavioral therapy to create an integrated approach, particularly effective for people struggling with depression. And it's mindfulness-based cognitive therapy is an evidenced approach for people at risk of depressive relapse to support their long-term recovery. And in the UK, the National Institute for Clinical Excellence has suggested that the NBC is a priority for implementation. So in the UK Health Services, people can actually be referred to have this as a form of therapy to help them with their chronic depression. Next slide, please. And then another one, another example that I'll put here is the mindful-based relapse prevention for addictive behavior, known as MBRP. And the structure and format is patterned after the MBSR, mindfulness-based stress reduction, and the MBCT, 8 weekly 2-hour sessions, daily home practices. And so they've got formal mindfulness practices, informal practices, and coping strategies that can help people be aware of what are their triggers to go and pick up another drink or to go again look for the drug-seeking behaviors, etc. And from this pilot that they did, just a summary there, the initial efficacy was supported by significantly lower rates of substance use in those who received MBRP as compared to those in treatment as usual over the 4-month post-intervention period. Additionally, the MBRP participants demonstrated greater decreases in craving and increases in acceptance and acting with awareness as compared to treatment as usual. Results from this initial trial support the feasibility and initial efficacy of the MBRP as an aftercare approach for individuals who have recently completed an intensive treatment for substance use disorders. Next slide, please. Okay, so now we're going to do another mindfulness practice again. Just we've taken in a lot of information there. And just taking a moment to do this face scan. So just sitting, lying, whatever it is that you may be doing right now. And noting where the mind has gone and been, and maybe a lot of questions are coming up and a lot of thoughts and a lot of, but for this moment right now, as we go into the face scan, you're invited to just ground yourself where you are and bring your mind. You may have your eyes open or a soft gaze and taking a few deep breaths. And as you exhale, allowing the weight of your body to relax into whatever is supporting you. So bringing a kind, gentle awareness to the muscles of your neck that carry your head all day long and inviting your neck to release any unnecessary tension on your next out breath. So just feel the neck release its tension, making any adjustments in your neck or your shoulders to allow yourself to feel more comfortable. I know that I often carry a lot of tension in my shoulders, in my neck, especially when I've been sitting for so long. And this is a time to just note, without judgment, the tension that's there and release it with each out breath. Just release that tension. Now gently shifting awareness to the muscles of the jaw and just noticing if there's any unnecessary tension there. I know for me, when I've been wearing a mask all day, in the evening, I do feel a tension in the jaw. So just releasing with each out breath, releasing the tension in the jaw with each out breath. And shifting awareness from the jaw to the muscles of the mouth, allowing the muscles to smooth and to soften. Taking time to care and appreciate these parts of the face that allow us to eat, drink, laugh, and just communicate. And maybe inviting a half smile and see what that does to the rest of the face. How does it feel to have a half smile? And moving awareness from the mouth to the eyes. Just noticing the muscles around the eyes. Appreciating the eyes and the work the eyes do. And just allowing the weight of the eyes to go out with each out breath, allowing the eyes to relax, giving them permission to relax. And from the eyes to the eyebrows and the space between the eyebrows, to the forehead. Is it wrinkled? Is it concentrated? Is it thinking? Is it worrying? Just releasing the forehead with each out breath. And how does it feel when the forehead is released? How does the rest of the face feel? Is there more relaxation perhaps in the whole of face when the forehead is released? And gently now scanning the whole face and scalp, as there's one big scanner that's over the scalp and face. And just scanning the whole face, scalp, and the neck and shoulders. And just offering a release for whatever tension there is with each out breath. So as we bring the practice to a place, just noticing if these few moments of self-care have made any difference to you sitting there after a long day. And maybe offer yourself a half gentle smile. And when you're ready, welcome back to the meeting. Thank you for your practice. Right, now we can go into the next one. Digital health and digital therapeutics. What on earth are they? Okay. So digital health is a wide-ranging term, and there's the health IT, which electronic health records, which we are familiar with, encrypted mail, messaging, telehealth, and all these platforms. And then there's what is known as mobile health, mobile digital health, and this is wellness apps, wearable devices, consumer fitness trackers, sleep trackers, and that's what we're talking about today more, the digital therapeutics. And these are found within the umbrella of the digital health. And they're defined as those that deliver medical interventions directly to patients using evidence-based, clinically evaluated software to treat, manage, and prevent a broad spectrum of diseases and disorders. And sometimes they can be ordered. And so these are examples. There's a website for Digital Alliance, that there's many digital therapeutics out there covering different health issues. And yeah, those are examples there. And then in terms of digital health, I thought it would be good to also point out that the Cancer Association of South Africa has got eKitBat, which is an online platform where you sign in, and through your email, so you can use your smartphone or laptop, they will send you guidance and support in helping to quit cigarette smoking, nicotine addiction. So this is a useful resource that we can use for anybody who's got access to an email or your smartphone, a laptop. This is a service they can use to help them to quit. I often refer people here, as well as offering those other mindfulness tools. Next slide, please. Okay, so having said that, let's look at the potential for digital therapeutics in terms of the opportunities as well as the consideration. And this is from the American Psychology Association. So on the left side, we've got the opportunities that during the COVID pandemic, digital interventions provided safe alternatives to inpatient care. Digital therapeutics have the potential to address health disparities if the tools are designed and implemented using a multi-level digital health equity framework. They can expand access to care by providing readily available and scalable solutions. Digital therapeutics is observed to be more cost-effective compared to treatment as usual. We already talked about constraints in manpower, etc. So digital therapeutics is an option to consider. And they can minimize time providers spend performing administrative tasks while increasing time with patients. Digital interventions have been shown to be efficacious across demographic groups, and they can be adapted across different socio-cultural contexts to deliver psychoeducation and treatment. Considerations we should keep in mind is that in-person care may be more beneficial for some patients and clinical scenarios. Some patients may just not be so comfortable with having to access a device. And if they're not implemented with digital health equity lenses, they could exacerbate health disparities so that those who can access them get to, and then there are others who may not be able to afford them cannot. Some patients lack reliable access to internet or smart devices, and that is why there's a need to have therapeutics that do not always rely just on having a regular internet connection, but allow you perhaps to download content and be able to go through it without necessarily being connected, being online, and there are such devices. And then there's also the assessment of patients' comfort with technology and digital uses is important. And I guess in the literature, what is said is that more and more people are using handheld devices worldwide, no matter what their other struggles may be, but it seems to be that it's a common occurrence that more and more people are having access to handheld devices. And then currently insurance-based reimbursements are limited. And need training to enhance provider adoption and integration into care. So the providers who are offering this need to be trained to understand what is it that this therapeutic is offering and how does it best work. And there's need to be development of strong privacy, data security policies, and informed consent. Next slide, please. Right, so now we're going to learn, we're getting into the habits, the neuroscience of how habits are formed. And we're going to try and play this video. Sound, Rakira? Thank you for your patience and thank you, Akira.
Why does your brain prefer cake to broccoli? This seems like a simple solution. Cake tastes better, but it's not as simple as you might think. And the real answer gives us insights into why we act certain ways and how to break bad habits. Ready to dive in? Let's start with why and how our brains form habits. The why is simple. Habits free up our brain to learn new things. Think about it. If every day you woke up in the morning and had to relearn how to walk, put your clothes on, tie your shoes, make coffee, cook food, and eat, you'd be exhausted before you even finished breakfast. Habits help us learn something once, and then we can automatically act that behavior out without thinking. Simple, right? So how are habits formed? Notice how every single action you take doesn't become a habit. Your brain has to choose what to lay down as a habit and what not to do again. How do we do this? We learn a habit based on how rewarding the behavior is. This is called reward-based learning, and it has three components: a trigger, a behavior, and a reward. Let's say you see your shoelaces untied, that's the trigger, tie your shoes, that's the behavior, and then don't trip when you walk, that's the reward. The more rewarding a behavior is, the stronger the habit. In fact, our brains set up a hierarchy of behaviors based on their reward value. The behavior with the bigger reward is the one we act out. This goes all the way back to our caveman brains that are set up to help us get the most calories we can so we can survive. For example, sugar and fat have lots of calories. So when we eat cake, part of our brain thinks calories, survival, so we start to prefer cake over broccoli. Our brains remember which foods are more rewarding, which is why our parents never served dessert at the same time as dinner. Given a choice, we'd fill up on cake before we ate our vegetables. But it's not just calories that count. Our brains also learn the reward value of people, of places, and things. For example, think back to all of the birthday parties you went to as a kid. Your brain combines all of that information, the taste of the cake as well as all the fun you had with your friends, the presents, and the ice cream, of course. All of this information goes into a single composite reward value. And this reward value gets reinforced with each party we go to. When you are grown up and see a piece of cake, you don't have to relearn what cake tastes like or remember any of the fun from the times you ate it. The association you learned as a kid kicks in. You just know that eating cake makes you feel good, and it triggers that automatic and habitual response to eat it. Think of learning a habit as set and forget. Set the reward value and forget about the details. This is also why it's so hard to break bad habits. If you're trying to cut down on automatically eating every piece of cake you see, what is the standard advice that you get? Well, use your willpower and just don't eat it. Think of all the calories in what? Think your way out of eating? This might work sometimes, but more often than not, in the long run, it fails. Why? That's not how our brains work. To change a behavior, you can't just focus on the behavior itself. You have to address the felt experience of the rewards of the behavior. If it were as easy as thinking our way out of a behavior, we'd just tell ourselves to stop smoking, stop eating cake, stop yelling at our kids when we're stressed or whatever, and it would work. But it doesn't. The only sustainable way to change a habit is to update its reward value. That's why it's called reward-based learning after all. So how do we update reward values and break bad habits? One simple ingredient: awareness. To change a habit, our brains need new information so they can see that whatever the value that they had learned in the past is outdated. By paying attention to the results of the behavior in the present moment, we can jolt our brain out of habit autopilot and see and feel exactly how rewarding or unrewarding it is for us right now. This new information resets the reward value on that old habit and moves better behaviors into automatic mode. Here's an example. In our Craving to Quit program, we don't tell users to force themselves to stop smoking or that smoking's bad for them. They already know this. Instead, we teach people to pay attention when they smoke. Most people start smoking when they're a teenager, so they've laid down a strong reward value for cigarettes, being young and cool at school, rebelling against their parents, all of that. We have them pay attention when they smoke so they can see how rewarding smoking is for them right now. What do they notice? After doing this exercise, someone in our program commented, "Smells like stinky cheese and tastes like chemicals. Yuck." Did you notice how this person paid attention? They weren't thinking, "Oh, smoking's bad for me." They brought awareness to their experience of smoking as they were doing it, noticing the smell and tasting the chemicals in cigarettes. Yeah, smoking tastes like crap when we actually pay attention. This kind of awareness helps us reset the reward value in our brain, which in turn helps us break that habit. Can awareness really help us change deeply ingrained habits? We wondered the same thing, so we actually did the scientific studies to see for ourselves. In our Eat Right Now program, where people use an app-based mindfulness training to learn to pay attention when eating, we built in a craving tool to measure exactly how rewarding certain eating behaviors are. The craving tool has them pay careful attention as they overeat or eat a certain type of food so that their brain can accurately update the reward value. We have found that it takes as few as 10 times of using the craving tool for people to update the reward value of their habitual behaviors and change their habits. In one study of our Eat Right Now program, we saw a 40% reduction in craving-related eating. Just think about this for a moment. This is huge. These studies show that people are no longer habitually reacting to their triggers. They don't have to force themselves to stop. They can move beyond willpower. How are they doing this? They're leveraging their brain's strength, the very same processes that set up their old habitual behaviors to break free from them. Now that you know how your brain actually works, it's time to update your approach to changing habits. Quit relying on willpower and go to the source, reward value. And don't forget, a little awareness goes a long way.
Thank you, Akira. So now we've heard about how habits are formed, and this is a simple tool that the Dr. Judd's programs uses, the apps use, and which I found very helpful just to download, even though the clients I serve may not have access to the app, but they can use this tool because I just go over the habit loop with them for them to be able to identify the habits. So there's the trigger, the behavior, and the results. And so we've got the triggers, what starts the habit, and just like that example that was given of the cake, it can be something you see or a place you visit as a thought, emotion, physical sensation. And the behavior is the habit itself. This could be the physical behavior like biting our nails, too much time on social media, mental judgment, worrying, self-judgment. The result is how we feel after the behavior. So how we feel in the short term, because obviously we're doing this because the behavior was serving us in some way, but how we feel long term, and not so much intellectually in the mind, but dropping into the body and getting a felt sense of how do I really feel when I act out this behavior. So for instance, I'm feeling stressed after a long day, feeling restless or hungry after a meal, coming home. And so I see some package there on the counter. I'm not really hungry, but I've got this restlessness, this whatever. So I see some packet of crisps there on the counter in the house. Then I just open the packet and, I go through the whole bag of crisps. Or since I don't eat crisps, let me say I go through a bag of nuts because that is what my habit loop would be. And in the immediate moment, I feel a bit of relief because I'm no longer feeling the discomfort and restlessness. But after a while, I feel really yucky because I feel like really full sick because I wasn't really hungry, probably. And it was rather a lot and eaten in a short time. So for me to step out of the behavior, it's not so much, like somebody don't eat nuts or somebody not hungry, but it's for me to sit with the discomfort that I get from acting out that behavior. This in time will help me to reset the reward value so that the next time I feel that way, maybe I'll find another practice that is more helpful for me to do instead of picking up that bag of nuts or chips or whatever it is. And this is So this is what he describes as this process that he calls the gears, so that I can be going in reverse gear, so that I'm just doing things automatically. I'm not even aware this is what I'm doing. I'm just finding myself eating and I don't even know that I've opened the fridge and I'm eating this chocolates or whatever. And then waking up, first gears, oh, I'm doing this thing again. What's happening here? And then second gear would be sitting in with, okay, what's really going on here and how am I really feeling? And the third gear is opting to step out, maybe to drop into my body and to feel, what is it that I'm feeling right now? Where are my feet? What do I really need to take care of myself right now? Am I perhaps just tired, hungry, lonely? What is it that I really need? That would be stepping out of that habit. So there are different practices that we can use. And if we go to the next slide, we just go over one common practice that's very helpful for stepping out of habit loops into third gear. And it's called the RAIN practice. So, and the RAIN, so we've got this urge to do something, to eat something, or to, I don't know, to yell at somebody or whatever, but you know, to do something, yeah. And rather than acting out that, how about just recognizing that there's a wave coming, there's something I'm experiencing without judgment, and invite the body to soften and to relax, as uncomfortable as it may feel, and accept and allow this wave to come, this wave of discomfort, of restlessness, irritability, whatever it is, craving, whatever it is that's visiting me in that moment. Just allow it to be, instead of trying to run away, push it away, or distract myself. And then get interested in the body sensations that I'm actually feeling. Maybe there's a tightness somewhere. Maybe there's a racing heart. Maybe I'm feeling my jaw clenching. Maybe I'm feeling some anxiety and fear. And just noting what it is that I'm experiencing without judgment. That, okay, so my heart's racing. I've got some heaviness. I'm sweating a lot. My mind's over racing. And I'm not thinking, what made me do this? Who made me do this? Why am I like this? No, I'm just attending to my body. I'm just attending to whatever it is that's arising in my body. So it's like if I have a little child and that child fell, I would just hold them, cradle them, instead of asking them, where did you go? Why did you fall? Who hit you? Whatever. So I'm doing that same self-care, loving, patient care to myself, because I am experiencing a distress. I'm experiencing something that's not comfortable. I'm experiencing something that has me urged to do something, run away, eat, whatever. Okay. And then just what's going on in my body right now. And then just realize that in just doing this and in doing it, usually it passes because I've attended to myself. And usually after this, the wave has passed and I have better wisdom as how to approach the next moment. Whereas, okay, I probably just need to have some water or drink some chamomile tea, or maybe phone a friend because I'm feeling so lonely or whatever time, but I don't need to eat right now. I don't need to go for that bag of nuts. So that's an example of the RAIN practice. And this is a practice that can be used in many of the programs for the relapse prevention and all that way. It's just an invitation to be with whatever is arising, because our default setting is to want to push it away, to distract ourselves, to run away, to refuse it. And whatever we resist persists. So if we can learn to just be with it and gently acknowledge it, then in time, we learn how to navigate these waves, which are part of human life, to navigate them skillfully. Next slide, please. Okay, so these are the apps that the Dr. Gilbert has developed that I work with. I work especially with people using unwinding anxiety, which is especially for anxiety, and then Eat Right Now, which was talked about with you. And then there's also one that said for people with smoking cessation, craving to quit. And Eat Right Now, the program for helping people with overeating, etc., that program has now been approved by the CDC Diabetes Prevention Program. So we actually offer it to people with diagnosis of pre-diabetes due to their HbA1c, and together with whatever the basic diabetes prevention program material is, in Eat Right Now, we invite them to bring a mindful awareness to the eating habits, to the what and how of eating, to the emotions, the feelings that surround whatever it is that they pick up, that they eat, and just to be more in tune with their bodies. Next slide, please. And some of the data from some of these apps that I work with is from the Eat Right Now. This is data for those from January, February 2023, that 55% of the members lost or maintained their weight, a 4.6% average weight loss, which is quite good for a diabetes prevention program. And then the maximum 29.1% was the maximum weight loss, and 19% of the members achieved at least 5% weight loss. And yeah, this is very encouraging. And these people that we are working with right now, most of them, if I may just clarify, they get access to this program through their medical insurance. So it's their medical, they're not paying for it themselves personally, but their medical insurance is allowing them to access this, and it's their medical insurance through their workplace. So this is an advantage that they have. Now, this on the left side is studies that have from the other apps. So the mindfulness training outperforms cognitive behavioral therapy fivefold in helping people quit smoking and target specific neural pathways for its effects. There'll be some references there that you will find in the notes. And another study found a 40% reduction in craving-related eating with the Eat Right Now, the Dr. Jad talked about in the video. And the unwinding anxiety demonstrated 50% reduction in generalized anxiety in anxious physicians. They actually did a pilot in anxious physicians. I don't know if anybody knows an anxious physician. And the randomized controlled trial of the same program of the unwinding anxiety showed a 7% reduction in JD scores in people diagnosed with generalized anxiety disorders. So it's really promising and encouraging data. And while I know we may not have access to the apps, but I think the basic tools that the app uses are tools that we can use in our day-to-day, as well as with the patients that we work with. Next slide, please. Next slide. Okay. So there's this paper here which I would really recommend you read, which was published in the American College of Lifestyle Medicine, at least it was in 2022-2023, that Dr. Brewer wrote when he was talking about this. And he says, current approaches to obesity, anxiety, and other behaviors that are driven by reinforcement learning may not be taking into account well-established theoretical models. Novel approaches that specifically target these mechanisms used through using awareness to update the reward value of behaviors show promise, like mindfulness training, which may help the field move away from willpower and cognitive control-based interventions that currently predominate, like, just looking for calorie restriction. My lab has found direct correlation between anxiety and physician burnout. Understanding the basics of how this process works can give clinicians simple tools to not only reduce their own stress and anxiety, but also to improve their relationships with their patients and to improve patients' outcomes more broadly. A physician who has used these methods to manage his or her own stress may be able to counsel patients more effectively from a position of authenticity and wisdom beyond simply recommending that one follow standard trial. Next slide, please. Okay, so I said I will not stop without reminding us about our PPE, personal protective equipment, or oxygen masks. And burnout has become all too common in the healthcare, from empathy fatigue, self-judgment, anxiety, healthcare professionals feel heavy. And from the Burnout to Resilience mini course, where you'll find links in the slides, you learn how to reduce empathy fatigue, identify unhealthy habit loops, work with challenging patients and emotions, and reduce burnout. So download the free Unwinding by ShareCare. It is a free app, this particular one, and you'll find this physician mini course. I think it's about 2-3 hours to go through it, little modules, but I really recommend. And if you find it useless, then you can just uninstall the app. But I have found it very, very useful. And yeah, because it's not easy being the ones who run towards the fire when everybody else is running away from the fire. And we as healthcare, we have taken this vow to ease suffering and to help people. And we need to know how to have our PPE on and how to have our oxygen mask on so we can be really effective and not burn out when we have to deal with so much suffering. Next slide, please. So this is just the one last practice that I would like to invite you to, and it is my wish for all of us that may we find stillness in the midst of chaos, may we be at ease in the midst of discomfort, may we be safe and well in the midst of uncertainty, may we live with kindness in the midst of all that is difficult, and we will find joy in the ordinary and the mundane. And I thank you so, so very much for having me. And yeah, sorry, I've run a little bit out of time over here with these slides. So these are resources that I invite you to check out. The Institute for Mindfulness South Africa, they have many, many resources there. And many colleagues will be very happy to work, because this is really part of lifestyle medicine, reducing stress and with substance use. And then if you'd like to explore mindfulness-based stress reduction at your own pace, in your own time, this is a free self-paced online course that is very generous. And the Habit Change Made Simple tool that I shared there, please, it's free to download it, play with it, look around, and just see if it's something you may find helpful for yourself as well as for your patients. And if you want to know more about the clinician mini course, it's there. And if you want to know more about MBCT, that's the link there. And there's a book, The Frantic World, where you can do the MBCT in your own pace. And the mindfulness-based relapse prevention, that's the website. And if you'd like to reach out to me, that's my email there, Sambatsarai Holistic Care, that's it. So thank you again.
Thank you so much, Samba. I think there was a lot that resonated in your talk. And I think something that really struck me was when you said a kid comes to you crying, we hold them. We don't ask them what's wrong, what happened. But I think that, unfortunately, that's actually what we do. Like, from a young age, you go to your parents crying and they're like, oh my gosh, what happened? What's wrong? And we almost automatically, from a very young age, teaching people not to just sit with their emotions. We're teaching them that it's wrong to feel sad, or it's wrong to feel this, or there must be a reason behind it. And I think that's a lot of the work that mindfulness is about, is we don't always need to have to get to the whys. It's the why now, or what's happening. So in the interest of time, Samba made a wonderful poem that I'm going to send out a little bit later, most likely tomorrow, as our CPD form. So please, everyone, do fill that in. That's how we get our CPD points, and make sure that obviously we benefit from being here and we learn a lot, but that we get the reward and make it a habit to attend our wonderful webinars. But in the meantime, I would like to open the floor to some questions. If you don't feel comfortable asking them, you are more than welcome to type them. Otherwise, please just put up your hand or ask. Does anyone have any questions?
Thank you. Hi, no, not a question, but just to say thank you very much. And I so enjoyed the practical meditations too, because I think it's such a reminder that meditation doesn't have to be lengthy. It can be brief moments in time where you center and move into the present. And thank you very much for the details about the practitioners guide for burnout. I didn't know that existed. So thank you very much for that.
No, absolutely. And I think it was fun. It was almost fun to practice it on ourselves and feel the difference in the middle of a talk, and to bring that awareness to the talk. I don't know about you guys, but how often are we trying to do 700 things? We have a webinar on, but we're also trying to cook dinner. And it kind of was like, no, we're doing one thing at a time, and our brains don't have to always be so exhausted trying to do 10,000 things at once. So before I end off, please let anyone else have any questions, comments, anything like that. If not, then I will be sending out the CPD form tomorrow. Please do remember to fill it in. If you guys have any comments, questions, reach out to myself or Samba directly. Otherwise, we really love having you here. It's our webinars are some of the highlights of our months. So we really look forward to seeing you next month. The newsletter will be going out, and then next month we will be looking at coaching with Simon Matthew. So everyone just stay tuned. And in the meantime, have a wonderful, wonderful week. Bye.
Thanks, Yakira.
Thank you so much. Thank you so much for having me. Bye.
Thanks, Yakira.
And thank you, Samba.
Bye.
Really, like I said, always so much to share, and it was wonderful. Thank you for joining us from Botswana. And we look forward to learning more in the future with you. Bye.
Yeah, about the PPE, perhaps.
No, it's 100% so important. So important. So thank you also for sharing free resources with us. That's amazing.
Thank you. All right. Bye.